If you would state your name for the record, who you're with, and your position on both bills.
Thank you, Madam Chair. My name is Dr. Joe Pojman. I'm Executive Director of Texas Alliance for Life, and I'm speaking for that organization in favor of Senate Bill 1944 and in opposition to Senate Bill 917. We support Senate Bill 1944 because it further improves a sound law, the dispute resolution process of the Texas Advance Directives Act. We oppose 917 because it completely guts the dispute resolution process. It will result in doctors being forced to indefinitely inflict medical torture on dying patients, the antithesis of the pro-life position. In 1999, the Texas legislature unanimously passed, and then Governor George W. Bush signed into law the Texas Advance Directives Act. It was the culmination of 14 months of drafting by a work group, including National Right to Life, Texas Right to Life, my organization, Texas Alliance for Life, and I was part of it, Texas Catholic Conference of Bishops, and numerous other provider organizations. All of us continue to support it, except one, Texas Right to Life. The act replaced an outdated statute first passed in the 1970s. That law allowed a physician to remove life-sustaining interventions from patients and granted safe harbor with almost no due process, merely a reasonable attempt at a transfer to another provider. No minimum time frame and no review by a third party. Replacing that statute was the sole motivation of our work group. Claims that the act was motivated by pro-euthanasia or pro-assisted suicide intentions are completely false. The Texas dispute resolution process compares very well with other state laws. The majority, 26, allows safe harbor for physicians to withdraw life-sustaining interventions under limited circumstances, as does Texas. Of those, Texas provides the most protection for patients. The closest is the Virginia law, which has a 14-day time to transfer and an ethics panel review. Passage of that law 4 years ago was supported by National Right to Life state affiliate, the Virginia Society for Human Life. In rare cases when a dispute cannot be resolved and a transfer cannot be found, the law provides safe harbor from liability for a physician, and we're speaking about Texas now, who switches from life-sustaining interventions to compassionate palliative care. However, the safe harbor is available only after meeting 12 due process requirements, including a review by the Hospital Ethics Committee. That committee can grant or veto safe harbor for the physician attempting a transfer. Our law does not allow hospital administrators or ethics committees to make medical decisions about which interventions the patient receives. Only the attending physician can do that. Please, do not gut our law. We urge you to keep our law intact and improve it by adopting Senator Lucio's Senate Bill 1944. I include on that handout a list of the 26 states, including Texas, article about Virginia, and our due process requirements in Texas, of which we have 12 that must be met before the physician can get the safe harbor. Thank you.